If your vision feels like a jigsaw puzzle missing a piece, you're not alone. Let's talk macular hole repair. So what exactly is a macular hole? It's a small break in the macula, the part of your eye responsible for sharp, central vision. Until recently, surgery to fix this was lengthy and had mixed results, but new techniques are changing the game. Today's advanced vitrectomy methods use finer instruments and high-definition imaging, making the procedure more precise and less invasive. What's more, the recovery time has significantly decreased. Patients now experience quicker vision improvement and fewer complications. One of the standout innovations is the use of biological adhesives. These help seal the hole more effectively, promoting faster healing. Plus, the introduction of special light filters during surgery protects the retina, reducing the risk of further damage. In short, if you're facing macular hole surgery, the future is brighter than ever. Your vision might just be in the best hands it's ever been. Thanks for watching, and stay informed.